Let's look at the first metric, which is bone metrics. DEXA gives us BMC, which is bone mineral content per body part, and BMD, which is bone mineral density. And this latter is reported in absolute numbers in grams per centimeter squared and as Z-score and T-score. The main parameters we're looking at in clinical practice are these T and Z scores. T-score compares your bone density to that of a healthy population of your own sex aged 20-29 when the bone density is at its peak. For example, if you are a male and you have a T-score of minus 1.0, it means that your bone density is one standard deviation below the median of a young, healthy 20-29-year-old male. And in practice, we use T-scores for women after menopause and for 50-plus-year-old males to check for osteopenia and osteoporosis and assess for the aging-associated fracture risk. And I'll put a table here. You can have a look. The Z-score compares the bone density to an age-matched population of your own sex. And this is something that we use to evaluate bone condition in children, premenopausal women, and men aged less than 50. I tend to interpret a Z-score of less than 0 as a red flag, which requires intervention, particularly in younger individuals. So how can we intervene to improve our bone mineral density? The mainstay is resistance training, so lifting heavy weights to load the bone and promote its remodeling, mineralization, and strengthening. And that needs to be complemented by adequate nutrition with appropriate amounts of protein, calcium, and vitamin D. And also for women in perimenopause, it's essential to consider hormone replacement therapy because adequate estrogen levels are essential for bone health. Depending on the age when we start addressing bone mineral density, we may not be able to increase it significantly. For example, if we start late. But at least our goal should be not to allow further decrease, particularly into the territory of osteoporosis, which will represent a fracture risk. All in all, the earlier we pay attention to our bone mineral density, the higher is the likelihood that we'll be able to address it at the stage where it's still malleable.